Hello everyone and welcome to your third educational presentation as part of your 90-day back pain program. So today's short presentation will be on the evidence-based treatments of back pain, and we'll be debunking and simplifying some of the complicated treatments out there and summarising what actually works and what doesn't. Also, I will be explaining why likely many of you are still suffering from back pain despite previous treatments, including physiotherapy, and delving into why this might be and what may be going wrong, and then bringing in how we can get you back onto the road of recovery and ultimately keep you there. So let's rewind all the way back to the very start of your back pain journey. And hopefully some of you may have seen a physiotherapist to get you back pain free, although, in reality, with busy lives, this rarely is the case. But let's hypothetically say you did. Now, if we think back to your first presentation where we discussed the different percentage reasons for back pain, these figures will become apparent again. So if I met you in the early days of your back pain episode, I would have assessed through questioning and physical assessment to determine the likely cause of your back pain. If I believed it was due to an underlying sinister reason, I would refer to the medical team for further investigations, likely an MRI scan. If I thought that your back pain was due to a specific and identifiable reason, such as a disc herniation, for example, I would treat according to that particular injury's evidence-based treatments. If, however, you fell into the 90% of back pain sufferers, I would start the process of treating your back pain via the evidence-based treatments for non-specific back pain. And it is these evidence-based treatments that we will be discussing through today. So, before we move on to the evidence-based treatments, it's important to divvy out which ones are not evidence-based and ones that we should not be considering and actually actively avoiding. But before that, it's important to justify where this came from. This table here is not based on my own personal opinion. It's based upon evidence from the National Institute for Health and Care Excellence. This institute is a regulatory body whose job it is to provide national guidance and advice that improve health and social care. Essentially, any healthcare professional, whether doctor, nurse, physio, or other practitioner, they follow this guidance and advice. And so it's clear to see here the nice long list of treatments which are not effective in treating back pain. Now, this doesn't mean that they are pointless, however, but just that they are not really that effective and not worth investing much time and or money into. And moving on to the try to avoid column. So opioid use, and we only really have to look across the pond at the opioid crisis in America to see how dangerous these drugs are for back pain. Even weak opioids, such as codeine, are actually only recommended if anti-inflammatory drugs if anti-inflammatory drugs must be avoided due to underlying health reasons. And even long-term non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen are recommended to be avoided in the long term due to the side effects which long-term use entails, such as problems with the stomach and liver. And then moving on to the surgery, the only spinal surgery which is generally considered nowadays is spinal decompression surgery. And this is where the nerves exiting the spine are compressed due to a severe disc herniation and therefore require surgery. However, this is generally only done in the most extreme cases. And plus, this surgery is indicated for people with a specific structure at fault for their back pain. They have a nerve problem, and this group falls into the 9% category, and therefore spinal decompression is not actually indicated in non-specific back pain or any other surgery for that matter. And now, this is a long list of non-evidence-based treatments, but there is still plenty of room available for the evidence-based ones, which are incredibly effective, which we'll come on to soon. But before we do though, and this is a really important issue that we should go through in a bit more detail, and we touched upon it briefly in the first presentation, but this slide will go that bit more in depth to explain why scans are just not worth the waiting list. And this infographic very neatly sums up why scans are very unreliable assessment tools for diagnosing why someone is suffering from back pain. It essentially flags up many false positives, and this is because of the huge majority of asymptomatic people, so people with no symptoms who have so-called abnormal findings on a scan. So for the lower spine, out of 3,110 people at the age of 50 who had 0 symptoms of back pain, 80% of these people had disc degeneration and 36% had disc protrusions. So we really need to be wary and avoid scans for back pain, as it just does not provide us with valid and reliable findings, as the scans evidently do not correlate with pain severity, and it is not able to accurately pinpoint why someone is suffering from back pain. And also, even if we hypothetically said that scans could pinpoint why someone's back is in pain, it would actually very, very rarely ever cause a change in the treatment plan. So they're just simply not worth utilising for the 99% of back pain causes. And lastly, before we move on to the evidence-based treatments, a quick summary around medication. So earlier we said that opioid-based medication and long-term non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen should be avoided, and they most definitely should in the long term. But it's important to remember that pain medication is actually a very useful pain relief tool to aid you in getting back moving and exercising, which enables you to engage in the most evidence-based treatment, which is exercise. And some top tips for pain medication. So over-the-counter ibuprofen is recommended for back pain relief over paracetamol due to being more effective. And also, pain medication, similar to, let's say, hay fever medication, it requires it to be taken regularly for it to build up in the system. For example, taking an ibuprofen every now and again when we feel some back pain is not going to be very effective in managing it, as the drug needs to build up in your system. But however, if you take regular ibuprofen daily, your pain will be much better managed, but keep it to short-term use. And as always with medication, always speak to your pharmacist or GP if you would like further support or advice regarding pain relief medication. But now on to the good stuff, the evidence-based treatments. So a much shorter list here than the one previously outlining all the non-evidence-based treatments, which is unfortunate, but is simply the truth. And these treatments right here are the only ones recommended by national guidelines as the most scientifically researched evidence-based treatments in the treatment and management of back pain. This is what works. And there is also a big difference between this list here and the previous non-evidence-based list. The main difference being that the majority of this list comprises of active-based treatments, whereas the previous non-evidence-based list fully comprised of passive treatments. So it's clear as day to state that active treatments work and are effective in treating back pain, whereas passive ones are drastically less so. And the difference between active and passive treatments is the engagement level of the person. For example, having ultrasound on your back is a passive treatment as someone passively does it for you, whereas exercise or lifestyle modification, for example, needs to be actively done by the person themselves, which requires a lot more time, lifestyle change, and motivation and consistency, and therefore engagement generally drops drastically, which is why many back pain sufferers fall off the road to recovery. Now, it's absolutely great news that these passive treatments are no longer recommended for treating back pain, mainly because it was the vast majority of back pain sufferers' port of call for treatment, which is completely understandable. In the busy hustle and bustle of life nowadays, finding time to exercise or the time to cook a healthy, balanced, nutritious diet can be difficult. Even getting 8 or more hours sleep per night is commonly a challenge, not to even mention the increased stresses and mental health toll present life has on us, all of which we now know contribute to back pain. And now, on the next slide, I'm going to be homing in on and discussing through the different types of exercise for back pain and explaining about which types are best for treating back pain. But all of the other evidence-based treatments will be described, explained, with top techniques about how to implement them into your back pain treatment routine in the coming weeks. But onto exercise itself. So, I would say the most important point to take home from this slide is that based upon high-level scientific research evidence comparing a whole host of different exercise types for back pain treatment, not one was found to be superior, but in fact all forms of exercise were found to be equally effective. So generally speaking, you simply cannot go wrong with exercise, providing you do it in a safe manner for that particular individual. And this is where the gradual progression point comes in. And this is why we have designed this back pain course the way we have. We're starting as light, gentle stretch, mobility, and release exercise, but gradually progressing up to more strength-based exercise, so something that you may not feel comfortable or confident doing now. In a few weeks or months' time, we'll gradually progress you that you do become comfortable and confident to do so. So essentially, in the same way a person training for a marathon would start off slow with low mileage, but then gradually increase to going faster and for longer, the principles are the same in back pain exercise management. And as with everything in life, it's about enjoyment. So whether it comes to hobbies, sport, cooking, baking, exercising, or reading, if we enjoy it, we are more likely to stick with it and be consistent. And this is absolutely vital. Because when it comes to back pain, consistency and exercising regularly is paramount. And this principle of maintaining a form of exercise during and far beyond this back pain course is something that we will be discussing further down the line. But now coming back to why exercise is imperative for back pain. Essentially, movement is medicine, or motion is lotion. Rest is rust, use it or lose it, however you want to say it. Exercise is absolutely vital for our health. This is because our tissues adapt to the demand we impose upon them. If we wake up, sit and eat breakfast, sit in the car on the way to work, sit at work, sit at dinner, sit on the sofa to watch TV, then rinse and repeat, your spine is going to get really good at sitting and not very much else. And this is why we've designed this exercise program, so that you can take a short 15 minutes out of every day to make the joints of your body move in a way that they don't typically move, such as how we have oral hygiene by brushing and mouthwash daily. We also need spinal hygiene by short bouts of exercise to ensure spinal health. But now let's talk about some of the reasons why you may still be suffering from back pain. Now, we know that the complex integration of how our lifestyle, brain, and body interact with our back pain, from sleep, stress, emotions, and exercise to name a few. And I suppose in a way, you'll have to think about your current lifestyle and what we have discussed to make an informed decision about what you feel is taking its toll in your life. For some, it may be persistent lack of sleep or high stress levels from work. Maybe some it may be long periods of inactivity due to having an office-based job or a complete lack of activity and exercise leading to being stiff, tight and weak. Whereas for some it may be a combination of all these factors. And this is what's going wrong. And this is why we have designed this course in the way we have, to give you the information, explanation, and then the tools to implement these changes into your life to improve your health and back pain for the better. Also, myself and Katie spoke to a large number of our back pain clients in order to find out what they personally thought and felt were the reasons why their back pain was either still causing pain or the reasons for their flare-ups. And these were the most common responses, and I'm sure many of you can sympathise and relate to these points here. And it is directly these points that we're addressing as part of this 90-day back pain course, focusing on the risk factors, the triggers, the regular daily exercise that can be completed conveniently at home, to education around back pain and the self-management techniques that you can utilise. And so it is by directly implementing these strategies that we have discussed, which are the key to getting you either on the start of the road or back on the road of your recovery. And through education around back pain and the influences around it and exercise, these strategies will be implemented into your routine throughout this course, and as you progress through it, you will be gradually progressed to continually improve your back pain. So I hope you found this presentation interesting and that you enjoy your week 3 exercise program, everyone, and I'll see you next time.